The third topic is a completely different subject, which is the use of the new oral anticoagulants, which, as we currently know, are the standard treatment for venous thromboembolism and for stroke prevention, especially in non-valvular atrial fibrillation. And this is because clinical trials have shown that they are not inferior to vitamin K antagonists, but they offer many advantages, such as a lower risk of bleeding. Their dosage is convenient, they do not require monitoring, and they have fewer interactions than vitamin K antagonists. However, their use in APS remains controversial to this day. Let's remember that the EULAR guidelines indicate that it is contraindicated in patients with triple positivity and arterial thrombotic APS due to the risk of recurrence, but it could be considered in cases of venous thrombotic APS, in cases where there is a contraindication to vitamin K antagonists or when patients are unable to achieve a target INR, ensuring adherence to treatment. To address this question, I relied on a meta-analysis of clinical trials that included adult patients with thrombotic APS and at least one positive antibody on 2 occasions, that is, the 2006 laboratory criteria, and used outcomes related to efficacy as variables. Above all, the most important ones are arterial thrombotic events and venous thromboembolic events, as well as safety outcomes. The rate of major bleeding. They conducted their analysis by groups based on antibody profile, comparing triple positivity versus single or double positivity, as well as prior history of thrombosis, and by sex. These are the 4 clinical trials included in this meta-analysis. 3 of them were conducted with rivaroxaban and 1 with apixaban, and they included 474 patients. We will now break down the results in terms of efficacy. Regarding the risk of arterial thrombotic events, a clear increase was observed in patients receiving direct oral anticoagulants. With an odds ratio of 5.43, the results were statistically significant in a meaningful way. However, these differences were not observed for venous thromboses, which were actually infrequent in both the control and experimental groups, nor were there any differences in terms of major bleeding. In the subgroup analysis, whether by antibody profile, prior history of arterial thrombosis, or by sex, no differences were found either. Therefore, the study concludes that there is a clear increased risk of arterial thrombosis in patients treated with the new direct-acting oral anticoagulants. And it seems that the greater effectiveness of vitamin K antagonists may be due to the fact that they block or act on multiple pathways of thrombosis. However, further studies are needed to determine whether oral anticoagulants may have a role in APS, for example, in patients with a lower risk profile, and as a final conclusion, their routine use in thrombotic APS is not recommended.